Hey guys, this is Dr. Dwain Woode. I am coming to you with an exciting book that I recently got. And if you saw me on Facebook or LinkedIn or one of our other social media platforms, you saw me open this book. And the book is a very interesting one, and it's called The Entree MD Method. Let me see if I can grab another screen so you can see what that looks like. So that's my book. That's the book right here, The Entree MD Method. Okay, and it's by Dr. Una. And when I got the book, I have not been able, guys, to put this book down, right? I have been reading it. I'm through the first section, and I wanted to do kind of a review of the first section, the overall review of the book so far that I've been reading. And it's fascinating. So it's 180. Let's see, 187 pages, right? 187 pages. It's an easy read so far. And what I like about it, the title, The Entree MD Method, a proven roadmap for doctors who want to live life and practice medicine on their terms. And as I was reading the book, right, when I started reading the book, I was back in medical school. So the book really talks about a trend that we're seeing within medicine. And the trend is that we are getting and seeing more and more physicians that are not happy with where they are. The vision that they had when they started medicine, when they went to medical school, when they decided that this was the profession that they wanted to have, what they're finding is that the life that they're currently living doesn't match what they envisioned. Right? There's been so many changes that have happened within medicine, from managed care, our insurances. I'll give you an example, right? So I treat diabetes as one of the things I do in our practice. So I'm an endocrinologist, and I see a patient in the office, and I make a treatment decision based on that patient, based on their blood sugars, based on what their A1C is, based on so many different factors. And I decide I'm going to prescribe a particular medication for them. And I put it in the chart, and I hit the send button electronically. So it goes out, and almost immediately we get back, it's not covered. Now here it is. I have made a clinical decision based on the patient that I'm looking at, and the insurance company says that medication is not covered for this patient. Now, the patient pays insurance. Yeah, right? They pay for their insurance policy. They pay for medication coverage with their insurance policy. But the medication that their physician, me, has decided that's clinically beneficial for them is denied. Okay. And so we spend our time now having to go through a prior authorization. If you've had this happen to you, you know what that is. So this is something that you fill out a form and you say, hey, this patient has tried this medication before. They've tried that medication before. They've had this side effect, or this one is not working. So now we've got to justify why we're giving that particular medication to the patient. Okay. That's one thing. The other thing is that the way the current system is set up, in order to make the kind of money that I need for my practice, for my team, for my staff, for my family, right? We've got to see a lot of patients. And that's how the system is set up. So you have to see a lot of patients. What does that mean? That means that for the patient, the amount of time that I get to spend with that patient is a small amount, because I've got to see more and more, right, to generate the income for the family and so forth. And so what ends up happening is that the time that we're seeing those patients is shorter and shorter and shorter. And that's by virtue of the way our current system is set up. There are so many other things that are going on, but we are finding, because of COVID, there are a lot of people that have reevaluated where they are. And this was a trend not just because of COVID. It was happening, but I think COVID kind of amplified it. Okay, so that people were all the time kind of thinking, hey, this is not quite what I signed up for. This is not quite the way I want to practice medicine. I want to take better care of my patients. I want to spend more time with my patients. I want to be able to treat the patients the way I clinically have evaluated them and have come to a decision. But I'm not able to do that because I don't have the autonomy. I don't have the control. I don't have the ability to do that, because a lot of physicians may be employed by some entity, and their regulations, right, are dictated by the entity, whether it's a hospital system or a private group or whatever it is. So things have changed within medicine in that respect. So when we went to medical school, I'll talk for myself. When I went to medical school, honestly, I thought when I came out that I would be able to set up a shingle okay. Let me tell on myself, right? So I'm old enough to remember these. You know the old picture that we have of the old doctor, the guy who took care of mom and dad and brother and sister and cousin and uncle, right? And knew the family. They knew Uncle Bob and cousin Bill and Aunt Sue, right? And was able to spend time learning about those people so they knew them. That's the picture that I had of what medicine was going to be like for me. Okay. And as we're treating now, that's not what we're having. And so we're finding that during the pandemic, a lot of people realized that the way things were going was not what they wanted. They also realized that their financial security was not as secure, right? Because if you read about stories and you hear about people who during the pandemic had to close their doors. There are physicians who are no longer in business right now, post-pandemic, well, not post-pandemic, at the end of what we're seeing right now, that were in business before. And they had to close their doors, right? Because patients were, of course, not coming to the office. We had to curtail what we were doing. We saw less patients. We had televisits, right, which was covered by the insurance companies. And by the way, the amount that you got paid for a televisit was not as much as you got paid to seeing that patient in person. You did the same evaluation, right? In terms of your clinical judgment, you took care of that patient. You saw that patient virtually, right? And you made a clinical decision, but you got less pay, right? That was interesting, right? And we saw that in our practice as well, where the number of patients we saw decreased, the amount that we were getting paid decreased. But you know what didn't decrease? The rent, right? So we're on the campus of one of the hospitals here in town. The hospital didn't come to us and say, hey guys, we know you're not making that much money. Guess what? We'll decrease the rent, right? We still had to pay the same amount of rent, and all the other responsibilities that we had, right? They still came due. So that didn't change because there was this pandemic that was going on. And so a lot of physicians found that, yeah, we're not as secure as we thought we could be. And so what I love about this book is that the book talks about the current state of our clinical, of our medical care, right? Talks about the current state of our medical care. It reminded us about the training, and this is talking about physicians, reminding us of the training that we did, the amount of time that we put in to train, to be where we are. Some of us 10, 12, 13 years, depending on your specialty. And it reminded us of the things that we wanted to do, the life that we thought we wanted, the types of patients we wanted to take care of, the way we wanted to take care of patients. And it reminded us of where we are now. But what I love about it, and Dr. Una, thank you so much for putting this book together. What I love about the book is that it was not a book that was all doom and gloom. In fact, in the book, Dr. Una says that despite everything that's happening in medicine, this is a perfect opportunity. This is a perfect time for physicians who want to pivot, right, to take care of patients the way they want to take care of patients. And that's part of the title of the book, who want to live life and practice medicine on their terms. So it's not a doom and gloom book. That's what I love about it, that it reminded us of where we came from, the desires that we had, what we wanted to do in terms of taking care of patients, but then says, hey, listen, don't let this deter you, right? Use this as an opportunity to pivot. You are creative, guys and gals. Do you know the amount of brain power, the amount of stick-to-itiveness, the amount of courage, the amount of power, and the amount of grit that it takes to get through medical? Well, first of all, to get into medical school, right? Right? To get into medical school, and then to make it through medical school, right? All the things that we had to memorize and learn and regurgitate, the exams that we had to take, right? Some of you are in professions right now or subspecialties within medicine that, guys, there are some things that, when I was in medical school, I was like, I'm not messing with that, right? Because that was huge. And I'm not even going to start calling names of different specialties. You know who you are. And that doesn't go for a particular specialty. Across the board, as physicians, you guys are intelligent. You gals are intelligent. You're smart. You're innovative. Think of all the things that we had to do, right? So I came through when, we still had to, and I'm assuming they still had to do it now. You had to keep those logs, right, of all the different procedures that we had to do, right? The intubations, right? The thoracentesis, the paracentesis, right? All the lines that we had to put in. I remember being on call. I trained up in Dayton. And I remember being on call and getting a call from one of our attendings that there were two preemies that were coming from an outlying hospital. Okay. And I was there and I had to intubate those babies. Right? Think of the delicate nature of that. Right? I remember being down at UAB, Birmingham, which is where I went to medical school, and being in surgeries, right? And working with the thoracic surgeons, working with the plastic surgeons. I remember being on OB and catching the babies, right? I remember being on family medicine and having to see all those patients. I remember being in the emergency room, emergency department, right? And all the patients that we took care of. I remember being on call as the senior and having that code go off, right? When everybody else is gone, there's nobody else in the hospital. You're the senior, right? And all your team is looking at you. The medical school, the first year resident, right? And one of the things that I often thought about was when there was something going on at the hospital, right? So the nurses, when the nurse who was taking care of the patient that was having a problem, all the nurses came around and was like, hey, can I help you? Right? Talking about the nurse. And I look around, it's like, well, where are the other doctors that are coming to help me? Because it was you. You were the one. And you made it through that. Think of the creative power, the creative ability that we have. To not see where we are as a doom and gloom problem, but it's an amazing opportunity for us now to take charge of our lives, take charge of our careers, and to manage our life the way we want to manage. Okay. And one of the interesting points that she made here in the book was that it could be taking charge of a medical practice. Maybe that's where you will find your managing your life on your terms. Maybe that's what it is. Maybe it's building a practice that you own, that you're not working for an entity. But guess what, guys? It doesn't have to be there. It could be anything, right? Because what we're trying to do is we're trying to take care of patients, become financially free, so that we can do the things that we want to do the way we want to do them, right? So that could be, I don't know, anything, real estate. It could be coaching. It could be investing, right? It's limitless, and you can do it. So I'm still going through the book. I've gone through the first part of the book, and I'm now getting into the second. We're gonna come back. We're gonna talk some more, and we're gonna get into more detail about this book. But I was just so excited. I wanted to get on and just let you know that, yeah, if you've not seen it, if you've not heard about it, it's called the Entree MD Method, and I think I'm a little blurry right there, but that's okay, right? The Entree MD Method by Dr. Una, and it is a wonderful book so far, and we'll come back and we'll talk a little bit more about it. So here on this channel, right, that's Dr. Dwain Woode, that's me, right? The E stands for endocrinology, like we say, but we also educate, we empower, and we encourage you to take charge of your health and your life. You can avoid complications, and you can go to the next level. That's why we do what we do. Thank you. We'll see you at the next video.